Welcome to Part 1, Adaptation to Pregnancy. Today we are going to discuss adaptation to pregnancy, both physical and psychological. Although pregnancy is a life-changing experience, it is not always embraced positively due to the physical changes that may range from the nuisance side effects and severe life-threatening events that you learned about in Week 1. There are a variety of psychological issues related to pregnancy also. Think about it. If we told you to expect a baby into your life in the next 9 months, how would you feel? How would it affect your life plans as they stand today? The Khan Academy videos, Maternal Changes in Pregnancy and Pregnancy Physiology 1, address the physiologic changes that occur. And these were discussed in Week 1. These changes affect the physical nature of the pregnancy. It is important that you understand the role of beta-HCG, estrogen, progesterone, relaxin, and human placental lactogen in causing the physical changes in pregnancy. In addition to the information in that lecture video and in your textbook, there are a few other changes you should be familiar with, including immunosuppression, hemodilution that results in edema, vena cava syndrome, and an increase in cortisol production during the later trimesters. We will start with immunosuppression. Because the fetus is a foreign body, the pregnant condition automatically enters into an immunosuppressed state in order to avoid rejection of the fetus. As a result, pregnant women are more at risk for infections, especially communicable diseases such as influenza and varicella. Therefore, as nurses, we screen women in regards to immunization status and encourage them to receive a flu vaccine during their pregnancy, and they need to get the injectable form, not the live intranasal, because that is a live vaccine. Vena cava syndrome. The weight of the gravid uterus contributes to this. The Khan Academy video refers to this as supine postural hypotensive syndrome. It is the same thing. In a supine or forward flex position, as in leaning forward to reach your keyboard when using a computer, or reaching for the steering wheel when driving, or bending over to tie your shoes, the uterus compresses on the vena cava, resulting in orthostatic hypotension. The patient will complain of typical symptoms of feeling lightheaded, dizzy, and/or nausea. As her blood pressure decreases, perfusion to the uterus and ultimately to her fetus decreases. As a result, if we happen to be listening to or monitoring the fetal heart with a fetal Doppler or on a monitor, there would be decelerations present. If it becomes frequent enough and severe enough, it can cause a neurologic insult to the fetus and cause the baby to relax so much because of this neurologic insult that they have meconium passage in utero. For this reason, we encourage pregnant women to lie on their side, and preferably their left side. Edema is a common physiologic response to pregnancy and worsens as the pregnancy progresses. Significant edema that occurs during the first and the early second trimester is a red flag for potential problems such as gestational hypertension, which will be discussed in a separate lecture. As hemodilution increases, which is a normal physiologic response, the colloid oncotic pressure decreases. Therefore, fluid shifts into the third space, causing edema. In addition, as the uterus increases in size, it puts pressure on the veins in the lower extremities, therefore reducing flow back to the heart. As a result, Most women experience some degree of edema in the feet and ankles. There are some women who can gain up to 10 pounds due to dependent edema, and we'll usually see this in the last month of pregnancy. If it occurs in the mid-trimester, that's a red flag. The generalized edema can also compress the nerves in the wrist and cause the carpal tunnel syndrome. The lower extremity compression can cause varicose veins as well as hemorrhoids, both very common complaints of pregnancy. The last physiologic change we're going to discuss is cortisol. These levels increase throughout pregnancy, especially toward the late second and third trimester. We will hear a little more about that increase in the cortisol level due to stress when you study domestic violence and its adverse effect on the fetus. An increase in cortisol results in a certain degree of insulin resistance, which leads to gestational diabetes, which we abbreviate GDM, in some women. And GDM will be explored in a separate lecture. This ends part 1 of Adaptation to Pregnancy, so go on to part 2.